One RN, Megan, and two nursing students, Rachel and Claire, are in the staff room about to begin day 2 of their orientation. They head down to the conference room to discuss important information pertaining to the clinic.
Hello. All right, so as you're aware, we serve the LGBTQ2+ community. And unfortunately, historically and presently, this community is often stigmatized. They face barriers when trying to access primary health care services. So when we work with this population, it's really crucial to be conscious of the language nurses use during any type of interaction. So here's a list of commonly used acronyms that you may or may not already be familiar with. You can just take a moment to read over them. Okay, so now I'm going to say a statement and then share ideas what you think I could have done differently, okay? So hello, my name's Megan. I'll be the nurse providing care for you today. My pronouns are her and she. What would you prefer we use for a pronoun?
I think that was a great introduction. You introduced yourself and your role and asked the client what pronouns they prefer.
I think the word prefer could maybe cause some issues. For example, you did not state the word preferred when you shared your pronouns. However, when you put the word prefer, it is not a preference for them, rather it's how they identify.
Yeah, you both gave some really excellent feedback. Claire, you did identify the error in my introduction and provided the correct explanation of why we should not use preferred in front of pronouns.
I have a question regarding why males having sex with males are more susceptible to contracting HIV.
That's a great question. Rachel, do you have any thoughts?
Is it because with anal penetration there's a higher likelihood of skin tears?
That can contribute to contracting the virus, but it's most likely due to the thin anal mucosa membrane that makes transmission occur more rapidly and easily. So I have a question. What protective measures can an individual use if their partner is positive for HIV and they are not?
The use of condoms.
Also monitoring their viral load and adhering to their antiviral medications and standard of care and doctor's appointments.
I've heard of a medication that prevents transmission for an HIV positive individual to an HIV negative individual.
Yeah, this medication regime is called PrEP, so pre-exposure prophylaxis. It's a pill taken daily by an HIV negative person to prevent acquiring HIV from their HIV positive sexual partners. So currently PrEP is provincially funded. However, certain blood work and viral load has to be within a certain range to receive the PrEP medications. So now we'll just review other comorbidities that this community is at greater risk for. Do you guys have any thoughts?
Body dysmorphia, intimate partner violence, and isolation.
Depression, self-harm, increased rates of cervical cancer for female to male trans individuals as there is a decrease in screening due to stigmatization and barriers to access primary healthcare services.
Yeah, great points. So as you can see, this population is susceptible to many mental health concerns. So it's really crucial to be aware when working with them of signs and symptoms of mental health concerns that may require intervention. It's also important to note that the LGBTQ2+ population has increased suicide rates and exposure to violence compared to the rest of the population. So if there are no other questions, I think we can move on to the tour of the facility. Just always remember that our language is an important aspect when working with this community. If you're ever unsure of the language to use, ask one of the nurses or ask the patient. They're often happy to share their insight and support your learning. So yeah, we look forward to having you here and hope you can gain significant insight when working with this population.